Thanks a lot, Daniel, and sort of thank you to everybody at Vatical for the invitation to talk again. So, yeah, I'm the founder CEO of a company called BioCorteX. Really exciting sort of work that we're carrying out. Have a fantastic team trying to tackle some really big problems in trying to cure diseases and trying to provide new treatments to people living with some really, really challenging diseases. The reason I'm looking so formal this evening is that I am a neurologist. So I see patients, and today was one of my clinical days, hence I'm looking more formal than what I would do normally. I'm also a neuroscientist and have a background in the microbiome and machine learning. So the undiscovered country. This is a reference, depending on your background, either from Hamlet or from Star Trek. For me, it was Star Trek, and what we'll be talking about is understanding how we can look at and identify areas of potential interest from a patent perspective. Now, the first thing to say that you've probably spotted in my background is that I'm not a patent lawyer. This isn't an area that is my native turf, but what we're doing at BioCorteX actually required us to tackle this problem head on, and I'll explain why. So this is Professor Stephen Hawkins, who unfortunately passed away of a disease called motor neuron disease, and for those who are in the States, this is ALS. Absolutely terrible disease. It's a neurodegenerative disease. So what do I mean by that? I mean that there is no cure for motor neuron disease or ALS. It causes progressive wasting or weakness of muscles. So people lose the ability to use their hands. They lose their ability to move their legs. They often lose the ability to talk and swallow. And unfortunately, the muscles that affect the breathing are also affected. Now, lots of people will remember challenge, and this was a number of years ago and has done a lot to raise awareness for the vast amounts of sums raised with that. We still have no cure for motor neuron disease, and we have no real effective treatments for this disease. Now, why is this important? Because A, it's a terrible disease that needs to be sorted out. But if we can cure motor neuron disease or ALS, we cure Alzheimer's disease, we cure Parkinson's disease, which have a massive impact on society. The cost of dementia alone is approaching 1 trillion per year. So huge societal impact. Now, what if I told you that there may be a treatment for motor neuron disease? Now, this isn't, we've had situations before in medicine where diseases have gone from being incurable to being curable. Just think about infections, before antibiotics, which actually wasn't that long ago, many diseases that we just brush off now were actually fatal. What if I told you we could actually make drugs more effective, particularly cancer drugs? So one of the areas that we're focusing on at BioCorteX, in addition to neurodegenerative diseases, is trying to look at how we can make cancer drugs more effective. So at the moment, unfortunately, if you are undergoing chemotherapy for a range of different cancer treatment or for a range of different cancers, whether you respond to that treatment or not appears to be luck. Up until recently, that was what was thought to be the case. And what if we could help not just at an individual level? So not only the person coming into clinic who I saw this morning, but if we can start talking about trying to improve things for cities and for countries at scale. And what if I said that this answer was actually lying right in front of us? It was actually in plain sight. Now, this is what I spend most of my time thinking about, sort of BioCorteX. You know, what would this look like? And what this is, or what we feel this is, or where we think these answers are, is actually in the microbiome. And our mission is to cure, and it's a strong word, cure, but you know, we are tackling a difficult problem here. We're going to cure neurodegenerative diseases by hacking the microbiome. At the same time, we're going to deliver enhanced therapeutics with a focus on oncology. So what is the gut microbiome? So the gut microbiome is all of the bacteria that lives inside our large bowels. So our large intestine. From a mathematical perspective, they actually outnumber us. So there are more gut bacteria living inside us than what there are us, as in Homo sapien cells, which is fascinating in its own right. Now, what's really unusual about the gut microbiome is this is Charles Darwin, obviously theory of evolution. We as a species have evolved, or you know, life has evolved through this process of selection. The microbiome has co-evolved with human beings. So what do I mean by that? I mean that there has not been a human brain that has ever existed that has not had an input from the gut microbiome. And this is across the species as well. So even little mice have sort of microbiomes, fish, well, certain, you know, it all have gut microbiomes. So this is something that appears to have really quite sort of magical abilities to be able to manipulate and to be deeply linked to our health. And from this perspective, of the 7.9 billion people living on the planet, at this very moment, their health is dependent in part on their gut microbiome. The difficulty is that there's a lot of them. How many is a lot? You know, people have different interpretations of what's considered a big number. So there are 10 to the 13 bacteria or viruses, and this is not including combinations. So 10 to the 13, to put that in context, because you know, 10 to the 13, how big is 10 to the 13? 10 to the 13 is 10 times more than all the stars in the Milky Way. So that's pretty big. So that is, you know, that is a large number by anybody's yardstick. So the question that we're faced with, although that we think we have this answer to completely change the way we think about treatment of these terrible diseases and of oncology treatments, although we think we have that answer in front of us, where do we start? How does one begin out of 10 to 13? Where do you start doing this? Now, if we were to adopt the conventional approach, we would pick one taxa. I would spend 10 years looking at that particular bacteria to see whether it had an effect or not, which would mean that the sun would burn out by the time we actually got even, you know, a very small dent into understanding this. And that's just the gut microbiome. But the situation is actually much more complicated than that, because the gut microbiome does not exist in isolation alone. And not surprisingly, or perhaps surprisingly, depending on your perspective, there is actually such a thing called the Earth microbiome. What do I mean by the Earth microbiome? Countries have their own microbiomes. What do I mean by a country? I mean, if you look at the soil, the water within regions, the microbiomes are different. And that obviously impacts what we eat, it impacts what we drink, which in turn impacts our gut microbiome. So this is a extremely large multi-dimensional ecosystem. There was a beautiful study looking at Hawaii. Hawaii has a very confined ecosystem, and it looked at the food chain and demonstrated very, very clearly that the gut microbiomes of the pinnacle of the food chain were determined all the way up from the soil to the plants to the animals lower down in the food chain. So our gut microbiome is likely dependent upon the Earth's microbiome. Now, by this probably dates me, but when I saw this picture, I just had to include it in a talk somewhere. But this was a disk drive. So a disk. So the amount of information we are talking about is absolutely massive here. Truly, truly, truly large data sets. So what's this got to do with the patent landscape? And why do you have a neuroscientist, a neurologist of a biotech company talking about the patent landscape? Well, the challenge is that when we look at the microbiome, when we start identifying bacteria that influence whether a particular country has a higher incidence of motor neuron disease or of Alzheimer's disease, and yes, we can accurately predict that now just from the microbiome. What the answer that we get is not singular, meaning we do not just get one particular bacteria that flags up. We get tens of bacteria, in fact, many more than that potentially play a significant role in. Now, obviously, as a CEO, we've always got to be thinking about our burn rate. And if I were to put a patent attorney to investigate what was out there for each of those bacteria, once again, we would, it would be quite a large burn rate, and it would take a phenomenal amount of time. So we needed to find a solution to this, and this is why we have taken the approach that we have. Vatical's been really important in this process. This is a simple schema. It's actually become much more complicated, but it essentially links the microbiome, in this case, the gut microbiome, to patents. So we have the patents from all of the patents from the US Patent Office. And we also have all of the scientific literature, in addition to drugs and diseases. Now, so what, or what's the use of this? Well, what this allows us to do is something that we think is, for us, it's an essential part of actually delivering on our mission to cure neurodegenerative diseases and enhance therapeutics, because it allows us to understand the patent landscape. So this is a core gut microbiome of over 2,000 people. This has been analyzed using a multi-dimensional or high-dimensional approach called topographical data analysis. And what we're able to do is we're able to map things onto this network. So we could map age, we could map the country of origin, we could map all sorts of different things. What we've done in this figure is we've mapped the patent landscape. So just to orientate you here, that we saw previously, but it's now color-coded. The red are the areas within the microbiome that have a large number of patents attributed to those areas of the microbiome. There are green areas which are obviously less, and then the blue areas, there are very few or none within that. This is how we then map on the literature hotspots. So these are areas where the literature these are areas where there are papers, very recent papers, looking at these particular parts of the microbiome. Now, the first thing to say, and I'm just going to flick between the two, the first thing to say is that, from a validation perspective, and this is always one of the key things with any form of knowledge graph, is how do you validate it, or certainly from my understanding. Not surprisingly, or perhaps reassuringly, there's a match largely between what the literature is publishing on, the in the same place in the mind. So this flows along the conventional academic approach of research an area, think you've got a therapeutic, patent the therapeutic, apply for that, more papers come out. But what's really interesting in this area is the differences. So this is what we refer to as the undiscovered countries. So these are areas that, if we look at the literature hotspots, so if I can, I'm just gonna get a laser pointer. Slightly mindful about the laser pointer because it's so if we look here, so this is a part of the microbiome that has a very hot from a literature point of view, so lots of papers coming out. Let's flip back to the patent landscape. Not very many sort of patents at all. Whereas these other areas up here, much more in line. Obviously, there are other areas like here where there's lots of patents, but actually, interestingly, not much literature. And so this is what we mean by the undiscovered country. And this allows us very, very quickly, in the matter of, literally in the matter of seconds, to be able to establish whether the bacteria that we are suddenly interested in, that we think may be important in curing neurodegenerative diseases, or may be important in enhancing oncology treatments, of understanding very, very quickly whether this is an area that has a large number of patents in, or whether this is an area that is actually quite sparse. And because we ingest the US patent data, it's released on a Monday, so it's automatically ingested. We are completely up to date with this. And we think this will be a significant advantage for BioCorteX because it will allow us to be able to navigate this space very, very rapidly, which we're very, very excited about. The other thing that we've been able to do, and we've been tweeting a little bit about this, about what we're able to do with the knowledge graph, is answer questions about the microbiome. The microbiome is becoming increasingly popular within society. I was having lunch, this was pre-COVID, when we were able to have lunch, certainly in London, out, and I was talking to somebody about the microbiome, and behind them there was a poster of a food product promoting what was labeled as a healthy microbiome. I wanted to, and so this is something that is becoming increasingly recognized in society as being important, which is fantastic. The challenge is, though, however, is that there's a lot of information out there which isn't necessarily scientifically accurate. So, for example, one of the unusual things about the microbiome is that it's very, very unique, meaning that everybody's individual microbiome varies dramatically. So the very concept of what a normal microbiome isn't completely clear at all. And in fact, normal is very, very different depending on where you are. So, for example, I think it was Maggie who lives in Boston, for the people in the US, if you look at the US from a microbiome perspective, the microbiome it's still very diverse, but it's less diverse than if you look at some countries within Europe, but Europe and America's microbiome are much, much less diverse than tribes in Central America. And so what is normal really is dependent upon, well, depends on your definition of what normal is. The other really curious thing about when we talk about what is normal is we can actually only label about half of the microbiome, just over half, depending on how you look at it. What do I mean by that? I mean that, out of the microbiome, but out of the species we talk about, we only have names for half of them, just over half. So there's a lot of the microbiome that we simply do not have a name for. If you don't have a name for it, then obviously that becomes much, much harder. But then knowing what is normal becomes a little bit, it's very questionable where if somebody says, well, actually compared to normal, your microbiome is X or Y. So one of the things that we're trying to do with Bo is we're introducing this to understand and to build the BioCorteX tribal community. So we're looking to launch a character called Bo. So Bo actually lives on our knowledge graph. Bo is obviously a social media persona for our knowledge graph. One of the key aspects about Bo is that Bo only deals with facts. And because we have the ability to be able to transverse what is an exceedingly large microbiome-based knowledge graph now, we're able to answer questions very, very quickly based upon the available evidence. And one of the things that we'll be looking to do is start to ask people to ask Bo questions about the microbiome, and for us to be able to talk about things in a very fact and a very scientific driven sort of manner. This is really, really important for BioCortex's mission, because it's important because in the same way that we believe there are bacteria that may be able to significantly help with neurodegenerative diseases and enhance treatments in cancer, the flip side is also true. There are likely to be bacteria that make things worse, and there are likely to be bacteria that stop treatments. The difficulty is we don't know which ones they are. So this is why manipulation of the microbiome really needs to be very, very carefully considered. So in summary, I guess what we're saying that we've done at BioCorteX, and this is really just the start of what we're aiming to do at BioCorteX. And once again, this is a shout out to our absolutely spectacular team who have put this together, and we can produce these results in seconds, and even the microbiome analysis in a matter of minutes. What we're aiming to do, or what we're aiming to do with the patent landscape, is allow us that flexibility to be able to focus on areas and to work within the confines of the known patents, but also to identify areas where patents don't exist, which we can target. But also in the context of Bo, we're extremely keen that we don't keep this knowledge graph and this information completely hidden away by BioCorteX, and we want Bo to be able to answer and address some of the challenges and some of the information out there about the microbiome and its potential link to diseases. And again, this comes back to BioCortex's mission. And again, this is, I make no apology that this is a phenomenally ambitious thing to be able to say that we want to be able to cure motor neuron disease and Alzheimer's disease and neurodegenerative diseases. But I say this as a clinician and as a neuroscientist, that I do completely believe that the answer is actually lying straight in front of us in the microbiome. And I think that the team at BioCorteX, thanks to, in part, the knowledge graph approach with Vatical, will actually allow us to be able to do this. We're really, we are a friendly bunch at BioCorteX, and I don't normally look this formal, so really sort of keen to chat about things. Please do sort of reach out. There are many other landscapes that this could be applied to. So please do just sort of ping me a message. Always happy to catch up, which is obviously much easier nowadays. Thank you. I haven't been keeping an eye on any questions, so Daniel.
Yes, thank you so much, Nik. As always, thank you very much. So this is the point where we would love to invite anyone that is joining us to raise your hand in Zoom. And that way we can invite you off of mute, and I'm happy to let you share feedback, questions, comments, whatever it is that you'd like to bring up. The floor is yours. Otherwise, as most of these talks go, they do get into some pretty deep waters topically. So if you need to digest a little bit, obviously, as Nik mentioned, do reach out either on the BioCorteX social or on our Discord as well. We would love to continue the conversation there. And as I mentioned, we will be back next week. We've got some additional community members coming in and chatting with us. And hopefully, Nik, towards the end of the summer, we can have you back on to share a little bit of updates on Bo and how things are going. That would be amazing.
Excellent. Always happy to do so. And if I appreciate that lots of the things that we've spoken about, people may disagree with about our approach. So we're really open, and I really would, we're keen to learn at BioCorteX. That's one of the things that I think, can be said about the team. The fact that you have a neurologist and neuroscientist talking about patents is a testament, I guess, to our approach to tackling problems. So really keen to hear both the good and the bad.
Absolutely. So with that, please feel free to raise your hand or drop in a question in the Q&A or the chat. Otherwise, we will we'll give you some time back, and we'll make sure we connect with Nik within the community.
Absolutely. Do you want me to answer? Sort of, Margaret's asked a question
yes,
about
absolutely.
The facts and Bo.
Yes, please do.
Margaret,
reading the question, although I'm not sure where it was posted, but please do just recap the question and then answer away. Yeah.
So Margaret's asked about facts, and quite rightly has put facts in quotes, that it's in the eye of the bow holder, which I must admit I may steal. I really like that. You're right, and I guess one of the things is being very open about what we do know, but also about what we don't know. And I think Bo's going to. There is so much that we don't know about the microbiome. One of the things that we need to watch for with Bo is that Bo's not just saying, "I don't know," all of the time. We do have a huge amount of information, or Bo has access to a vast amount of information, and so we obviously as a scientist and as a clinician, Bo has to be accurate, and where we don't know the answer, Bo will be very, very open about that. And where there's interpretation about that, absolutely. But yeah, I completely take your point, Margaret. Was there any other questions you had about that?
And And Margaret, I'm happy to allow you to talk if you'd like to. Well, I know that is a little bit scary sometimes, but that is obviously available. While maybe Margaret's thinking about it,
yeah,
Anna has come on. Hello, hello.
Yeah. Hey there. Can you hear me?
We can.
Yeah. I hope you guys are doing okay. I had a question about the feedback loop between mental health and the BioCorteX, I guess, where if there is a better mental health, does the microbiome heal itself or like stay healthier longer versus treating the microbiome later on and then psychological health getting better?
Yeah, that is a really good question. So just so that I understand it, I'm going to phrase it in the way that we believe in the same way that with neurodegenerative diseases, there's a link between the microbiome and neurodegenerative diseases. There's also really, really exciting work, and this is an area, that's certainly on our radar, about health and about the interaction between the microbiome and mental health. And there's as I understand it, the chicken and egg situation about what's the microbiome, which changes first, and is it an association or is it causation? One of the really unusual things about the microbiome is that you have the ability to prove causation by dropping it into a mouse model or certain animal models. So if you think a particular bacteria is involved in a disease, then mice typically aren't fussy eaters, and so essentially you transplant the microbiome. It's not overly complicated, as you can imagine, because they're not fussy. And you can see whether it affects the disease or not, sort of directly. The challenge there is from the point of view of, in humans is actually access to that data and actually having that understanding of which came first, about whether it's association or causation. And that's one of the challenges, I think, with this area is understanding which comes first. But one of the advantages is we can move to causation quite quickly. I mean, that doesn't directly answer your question, because I've sort of said we need to do more work on it, I guess.
Yeah, no, I've been studying this stuff for feels like my life almost, but I lose myself into it. Can I push you on that topic just one more time?
Of course.
So I guess my real issue is that there's always fragmentary issues or just tangential issues that seem to grow when psychological problems persist, and it's never really it doesn't seem like one solution treating externally or after the problem has set in can ever rid the individual of the psychological troubles. And so, or the microbiome troubles, whichever one you wanted to treat at some point. So in turn, my thought is where it would start if you chose to start resolving something first, microbiome or the psychological part, in the long term, leading to fewer issues rising up in the individual.
Yeah, and first of all, look, thank you for pushing me on this point. And believe me, I don't view it as I'm really, really excited to answer sort of questions, because it makes me think, and it makes me think about things in a different way, which as I say, we really value sort of continuous learning at BioCorteX. Yeah, where would we go? So putting on my sort of clinical hat, prevention, there's the age-old saying that prevention is always better than cure. And I think that's one of the exciting areas of the microbiome is that you can talk about altering altering effects, you know, at a population level. But at that individual level, you're right. You know, we are complicated. You know, we are complicated beings, and there is no way that, as much as I believe the microbiome holds a key to a whole new era of sort of therapeutics, you know, it's suddenly not going to be the magic key when it comes to how we feel, and certainly dealing with past psychological sort of challenges. Whether things like whether things can aid that process or not, you know, there may be that potential, but this is not, you know, I don't replace the really important need for therapy and for counselling, and for, you know, for more formal treatment of psychological and psychiatric problems.
Yeah, I didn't mean to put you down in any way. I love this stuff.
Oh, no.
And I got on Meetup, and I didn't really talk to anybody my age about it. So I go on YouTube, look up Dr. Gabor Mate or something, but I'd like to speak to somebody in person. I'll reach out. I know I will.
Okay.
So at least having a conversation was a good start. Thank you.
Yeah, no, look, always happy to, yeah, always happy to catch up. And it's one of those, it is one of those questions with the microbiome about the chicken and egg scenario, about where do you start. And ultimately, you know, there's been some really interesting work showing, actually, I mean, this is gonna be stating the obvious in some regards, but our microbiome starts at birth, but depending on how you're born affects your microbiome. So if you're born via a C-section versus a normal delivery affects your microbiome, which then is associated with different illnesses when you're 6, 7, 8 years old. So the beginning in all of this process, I'm not certain where the beginning is, if that makes sense. But that's the exciting part of it, I guess. And just to say thank you to Margaret for giving me permission to steal the bow holder phrase, which I certainly will do. So thank you for that.
Thank you.
Thank you, Ron. I really appreciate that. And yeah, really encourage you to connect and continue the conversation. That's excellent. And appreciate you, Maggie, as well. If there aren't any questions, and the chat section is actually giving me trouble. So Nick, if you see any in the chat, please do shout out. Otherwise, I think we are good to wrap up. And once again, Nick, thank you so much for joining us and sharing. We definitely will have you back later this summer to share updates. And everybody else, wherever you're calling in from the world, whether it's morning, afternoon, evening, we're glad you're here. And we're so excited to have you back in the community. Thank you so much. Thank you, Nick. Any final parting words?
No, just to say, look, thank you to everybody at Therapeutic, and it's a great community. And yeah, thank you everybody for attending.
Thank you so much. We'll see you soon. Bye, everybody.
Bye.